you are doing well. Abdullah is here. Today we are going to discuss our second part of the video, that is about abdomen, lumbar and pelvic region. So let's start. First structure that is given to us here is the common hepatic artery. Okay, common hepatic artery. So as you can see here, it's this one. Let's zoom it a little bit. This one. This is a common hepatic artery. It is the artery that branches off from the coeliac trunk. This is coeliac trunk, and supplies several abdominal organs like pancreas, stomach and liver. Okay, so this is a general look of common hepatic artery. Okay, let's move to the next. Next we have Calote's triangle. So what is it actually? It's here. You can see here. I'm gonna show you a picture before that is more clear to us. Here you can see this is the Calote's triangle. Calote's triangle, it's you can see here at this side, like on the left side laterally we have cystic duct, on the right side you have the common hepatic duct, and on the superior side it's the inferior part of the liver. Okay, so it's called Calote's triangle. It's also called cystohepatic triangle. Okay, cystohepatic because of that it's cystic duct and it's hepatic duct, so it's called cystohepatic triangle. Okay, on the poster it's showing like this. For example, if we will zoom a little bit, so here as you can see, this is our cystic duct, this is right common hepatic duct. Okay, so this is Calote's triangle. So let's move to the next. Next you have superior mesenteric artery and vein. So as you can see here, this one is the superior mesenteric artery. Okay, and superior mesenteric artery, it runs behind the pancreas. Okay, and our second part is superior mesenteric vein. As for vein, you have to come to this poster. As you can see here, this is superior mesenteric vein. Okay, so let's move to the next question. Next we have inferior mesenteric artery and vein. So let's see, this is our inferior mesenteric artery. It has four major branches: left colic, sigmoid and the superior rectal branches. Okay, this is the superior rectal branch. So it has these major branches, four major branches. Okay, so next we have to recognize the inferior mesenteric vein. This is inferior mesenteric artery, and on this poster you can observe the inferior mesenteric vein. Okay, so next what we have ileocolic artery. So let's come back to this posture. So this is the ileocolic artery. It is the most inferior branch of superior mesenteric artery that we discussed just now previously. This is the superior mesenteric artery, so this is the inferior branch of superior mesenteric artery, which is called ileocolic artery. It supplies to the distal ileum, distal part of ileum or cecum, you can say, or vermiform appendix, or proximal ascending colon. Okay, so next we have appendicular artery. Let's get back to this posture again, and here you can see this artery. This is the appendicular artery. Okay, It is the branch of iliacoelic artery, which is the branch of superior mesenteric artery. So what supplies the appendicular artery? Appendicular artery supplies the blood to the vermiform appending, so that's why it's called appendicular artery. So guys, we have uh, next we have Riolan's arch. Riolan's arch, as you can see on this poster, it so let's observe this arch, how it's gone. It started near the superior mesenteric artery, as you can see, and it went towards the point of inferior mesenteric artery. So this arc has a preserving effect in this region. It reduces the risk of ischemia, or it provides the collateral mesenteric circulation in 10% of individuals. So guys, this is a general look. Next, let's see what we have. We have here superior rectal artery. Let's see it on the poster. How can we recognize it? Here you can see the superior rectal artery. It is a continuation of inferior mesenteric artery, which we already discussed previously, and it provides the blood to the rectum. Here you can see the rectum. It provides the blood supply. Okay, next we have retroperitoneal space. Let's see, where is it? So guys, as you can see in the screen, the retroperitoneal space. It is it is an anatomical space located behind the abdominal or peritoneal cavity. Okay, as you can see here, this is the retroperitoneum. So next we have told fascia. So let's see. As you can see here, different fascias are showing here. In the blue color, in the blue line, as you can see, it's a told fascia, and in the black you can observe the peritoneum. Okay, so what's the main function of this fascia? It's just help to mobilize either the ascending or descending colon, means to reduce the friction. Okay, so let's move to the next. Here we have paracolic cellular tissue, or you can say paracolic cellular space. So let's see. Here you can have a general look of paracolic cellular tissue. So this is the space, okay, paracolic cellular space. It is just located between the colon and abdominal wall. Let's see on another poster how it looks like clearly. So as you can see here, this is the colon and this is abdominal wall, okay, and the space between them is called paracolic cellular tissue. This one is on the right and this one is on the left side. Let's see next structure what we have given. We have next paranephric body. As you can see here guys, this is a paranephric space or paranephric body in the retroperitoneal cellular tissue. It's actually a fat pad surrounding the kidneys in the retroperitoneal space. Next, what we have retroperitoneal cellular tissue. Here you can see it's a retroperitoneal cellular tissue or retroperitoneal space. You can call it as the same because we discussed it previously, retroperitoneal space. Okay, next what we have Petit's lumbar triangle. So let's see what is it. Yeah, here you can see it's like looking very small on this posture. You can have a look here. This is the Petit's lumbar triangle, and it's also called as inferior lumbar triangle. So let's see the muscles that surround this triangle. Anteriorly, you can see the external oblique. Inferiorly, you can see this one iliac crest, and posteriorly, you can have a look of latissimus dorsi. Here I want to show you a picture where all muscles already labeled. You can see here external oblique, latissimus dorsi and iliac crest. So this is our inferior lumbar triangle or Petit's triangle. Okay, so this is the general look of this triangle. So the next structure we have here quadrilateral of less gaft. Okay, this is also a triangle on the dorsal part in the lumbar region. So let's see what is it. So here you can have a look of this triangle. So this is superior one and here inferior. Let's see its limitations or borders that surround this triangle. Here you can have a look of 12th rib. Here you can see internal abdominal oblique muscle, and at this side you can see paraspinal muscles. Here you can't see because here other muscles are covering. Okay, when you will remove these muscles you can have a look. So in this picture you can see the muscles, paraspinal muscles. Okay, it looks like what? Internal oblique, and this is the 12th rib. So this is your superior lumbar triangle, or you can say Greenfeld's triangle. So let's move to the next structure what we have given, the lateral border of erector spine muscle. To find the lateral border, you need to first understand what is erector spine muscle. So let's have a look on this erector spine muscles. Actually, this is a group of three muscles which includes iliocostalis, longissimus, and spinalis muscles. Okay, so we have to find the lateral part, right, for this muscle. So obviously it will be the iliocostalis because it's the lateral part of this muscle. So the next structure that we have to find here is the 12th number of rib. Okay, let's see. We already saw it in the previous poster. So let's see one more time. Here you can see it's the 12th number of rib. So let's move to the next part. What we have to find next. Next is linea terminalis. So let's find this structure and see where is it. So linea terminalis is also called as innominate line, which consists of different lines: pectineal line, arcuate line, and the sacral promontory. It's the boundary between the lesser pelvis, as you can see here. This is lesser pelvis and the greater pelvis. Okay. Next we have peritoneal compartment of lesser pelvis. So let's see the structure. Upgoing structure is peritoneal compartment of the lesser pelvis. So I will show you two pictures for this one. One is drawing and one will be on the poster because drawing is more clear. So let's see first drawing, then we will further move on the poster. Okay, so here you can see this is the peritoneal compartment of the lesser pelvis or lesser pelvic cavity. Okay, so this is the general look. Let's go to the poster one. We will this one. Okay, this is peritoneum, visceral peritoneum, and you can see this one. This is the peritoneal compartment of lesser pelvis cavity. Let's move to the next. Next, we have subperitoneal compartment of lesser pelvic cavity. It will also the same drawing and then the posture. Let's see. So here you can see this is a subperitoneal subperitoneal compartment of lesser pelvic cavity on both sides. Okay, so let's move to the posture one. Here you can see under the peritoneum you can find the subperitoneal compartment of lesser pelvic cavity. So let's move to the next we have subcutaneous compartment of the lesser pelvic cavity. Okay, so here you can see it's this one. This is the subcutaneous compartment of lesser pelvic cavity. Okay, here you can see subcutaneous bodies. Next here we have vasicouterine recess of peritoneum. We are going to find it here. So let's see, we have vasicouterine. This is vesicle. Vesico means bladder, and this is uterus, which means uterine. So vasicouterine recess you can see here. Let's zoom a little bit and you can have a better look of these preparations you can see here. Okay, vasicouterine recess. Next we also have this is also a recess, uterorectal recess of peritoneum. Here you can have a look. uh, this is the uterus and this is rectus. We have to find the uterorectal recess. Okay, so here you can see this is the uterorectal recess. Next we have vesicorectal recess of peritoneum. This recess vesicorectal is found only in males. As you can see, this is the vesicle, or you can say bladder, and here is the rectus. Okay, and this is the recess between them. So it's found only in the males. In females, it's absent. So the next, what we have, prostate gland. Have a look here. You can see the prostate gland, which is located under the bladder. Okay, the main function of the prostate gland is to produce the fluid which helps to nourishment the serum of sperms in order to reduce the friction, so their damage rate will be low. Next structures is the seminal vesicles. So let's see it here. You can see this is the seminal vesicles. So seminal vesicles produce serum. Okay, and this serum go to the epididymis via the vas deferens. Vas deferens is a tubule which connects the seminal vesicles to the epididymis. Okay, next see what we have. We have ductus deferens. This structure includes a bladder, prostate gland, seminal vesicles, vas deferens, epididymis near to the testes. So vas deferens is a tube which conveys the serum from the seminal vesicle to the epididymis. It's the main function of this tube. Our next structure here is the male urethra. So have a look. So here you can see this is a male urethra. It is a tube. It has two main functions. First is the urination and the second one is the sperm ejaculation. We have here prepuce of penis. Have a look on this structure. So prepuce it just means foreskin. Here you can see this structure. This is the foreskin. Okay, and this back, is a gland, but only the upper skin. Foreskin is the prepuce of penis. So next structure we have urogenital diaphragm. So let's have a look on this structure, how it looks like. You can define this structure like it's the strong muscular membrane that occupies the area between pubic symphysis and ischia tuberosities. This is pubic symphysis, and ischia tuberosities is a bone of the pelvis. This is the ischial tuberosities. Here you can see ischial tuberosities. Okay, so let's move to the next. So next structure that we have given here is the pelvis diaphragm. So let's have a look on this structure. This diaphragm is mainly composed of two muscles. The first one is levator ani that you are showing here. This one, levator ani, and the second is coccygeus muscle. These two muscles combine together to form the pelvis diaphragm. Okay, this is pelvis diaphragm. So next we have to find the genital neurovascular bundle. So it's the genital neurovascular bundle which runs on the dorsal side of the penis and passes between the hemispheres of corpus cavernosum. As you can see here, the hemispheres, or you can see superficial dorsal vein, deep dorsal vein, and pudendal artery, nerve and vein, etc. And the last one we have here, ischiorectal fossa. Let's have a look on this structure. Here you can see on both sides is the ischiorectal fossa. It's on left side and it's on the right side, and uh, in the middle there it's a anal hole. Okay, so on both sides it's the ischiorectal fossa. So friends, that's all for today. Thank you for your attention. Udachi.